Hi there, I'm Mr Shyamalan, consultant hand, wrist and elbow surgeon, and I'd like to do a patient educational video on tennis elbow. Hello.
Hi Mr Shyamalan, could you talk me through what I might expect in a consultation with you, please?
Absolutely. Usually your GP's referred you because you had a problem with elbow pain, and I'd certainly do a history and speak to you about what symptoms you have. Most patients with tennis elbow complain of pain in the elbow itself, radiating down the back of the forearm to the hand, perhaps weakness in gripping aspects. And examination-wise, they tend to be quite tender. If I just roll up the sleeve up here, they tend to be quite tender actually over the elbow itself. Now, the muscle that extends the wrist and the fingers all coalesce into an attachment here, the common extensor origin, and that can be quite tender. So pushing on there is tender, stop me pushing down, and doing this, also stressing it, can be quite tender. So with that in mind, it's very much a clinical diagnosis that you can make tennis elbows diagnosis.
So would we need any other investigation work done, or is it just through clinical observations?
Once again, depending on the chronicity, which means where and how long you've had your symptoms, and what other medical problems you may have. I mean, if you're an arthritic patient, slightly elderly, perhaps I'd get an X-ray. Ultrasounds can show you any inflammation. An MRI scanning of the elbow can show you the actual tendon origin and the surrounding cartilage as well. But I would say most patients, you can just diagnose it by the history, tennis elbow, tender in this spot. Certain tests trigger off the pain, and then by trying to see what activities trigger it off as well.
So once it's been diagnosed, what would be my treatment options then?
So after a period of time and it hasn't settled, and presumably you may have tried some simple pain relief, but definitely pain relief is a good start. Anti-inflammatory gel in the area and massage. Certain activities trigger tennis elbow, and avoidance of those activities, and stretching. And stretching the origin of the tendon, so by keeping an extended elbow and allowing that to stretch. Can be a little bit uncomfortable initially, but should start to, hopefully, by blocking the lifting and the carrying, should start to improve the pain levels. It tends to improve of its own accord in 80% of patients, even without physio or any treatment. So sometimes it's a time factor. The physiotherapy, we refer you to the therapist. They do certain exercises that load the tendon, which basically put the tendon and the muscle under strain. And initially that can be quite uncomfortable. The use of forearm clasps, which essentially go around the forearm, that offload some of the pain. Some physios use acupuncture. There are uses of ultrasound or shockwave therapy. So when someone has lots of different modalities to treat a condition, normally because no one thing works, but as I said, the good thing is most of it should resolve in a period of time anyway.
So a question that springs to mind is, presumably I don't have to play tennis to have tennis elbow, do I?
No, you don't. And actually it's interesting because the tennis elbow is more on this side of the elbow, and people relate golfer's elbow to the other side, and you don't need to play golf either. And it's a standing joke, a lot of people saying, how can I get golfer's elbow when I don't play golf? And actually those people who play tennis could end up getting golfer's elbow, and vice versa, golfers could get tennis elbow. It could really be just triggered by doing a lot of activity in a short period of time, like building a shed or doing a lot of carrying, lifting, or it can chronically come over a period of time.
And so what would my treatment options be then?
Definitely first trying to avoid the activity that causes the pain. Rest, simple anti-inflammatories orally, ice, stretching. We do use injections, and injections can be two types. There's the steroid injection, which is much for pain relief, but looking at the evidence, I'm not sure if it has that long-term evidence for its use. Other people certainly use your own blood, interestingly. That always gets a reply when I say that, where we take out the blood from your arm and you can inject the blood directly around the tendon, and that is more a regeneration aspect. The blood gets spun in a tube and the platelets get put back in straight away. Unfortunately, after a period of time, perhaps 6 months, trying all these different treatments, if it still doesn't work, then we may have to talk surgery.
And could you talk me through what surgery might involve?
Yeah, surgery tends to be done under day surgery, general anaesthesia or block where the arm goes numb. And we make a small incision actually just over the elbow on the lateral side, on the outside of the elbow, where you go down to look at the tendon where it comes onto the bone. That area looks quite white. It looks not very healthy. There's no great blood supply. So it's not really an inflammatory condition that looks red, hot and angry. And you tend to just remove that damaged area and then stitch up, allow the elbow to move straight away, protect the wound for a week or two. Simple tasks, writing, using cutlery you can do straight away. You can move the elbow straight away, wrist, neck, shoulder. Once that's settled, then we bring in the lifting and the carrying. So it's almost like a functional rehabilitation. The more you do, the more you can do.
Okay, so that's a recovery. What would be the time span from some
I would say
surgery?
most people should be able to drive by 2 weeks, do the simple lifting by 4 to 6 weeks, and heavy lifting by 6 weeks to 3 months. And really the pain should be settled within, I would say, 6 weeks. Most of the acute pain of tennis elbow should settle. And it's a 9 out of 10 procedure. 90% of patients are very pleased with this kind of operation, in that they've tried the rest, the avoidance and all the other things first, because tennis elbow can improve of its own accord in 80% of patients within 6 months. So the odds are on your side for it to improve.
And so should I need to be mindful of any complications for any of the treatment?
Absolutely. Complications of any surgery really pertaining to the surgery itself, whether it's infection, swelling, discomfort, scar sensitivity, but they're minor, and a lot of these we can pick up straight away and treat accordingly. But the main one is actually you still get pain. And how I describe it to patients is you reset the clock. So you do a procedure, the patient rests, and you reset the clock. And if you don't give yourself time to reset the clock, if you throw yourself out back into the activity straight away, then sometimes they do have a little bit of discomfort. But you need that time to just pause, rest, and then start again.
Thank you.
Thank you.